You just had a baby. Everyone's talking to you about changing babies' diapers, breastfeeding, strollers, what swaddle to use, but nobody's telling you what's actually happening to your body. Why does the body not feel the same? And how can you get better and recover from it? Well, brace yourself, because today we're going to learn all about postpartum recovery, or in simple terms, how to recover after you've given birth. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. If you're new to my channel and like what you see, don't forget to subscribe and share it with a friend, especially a friend who may be pregnant or considering pregnancy. Trust me, they'll thank you. I recently saw a patient. Let's call her Sarah. So Sarah had a healthy pregnancy and a wonderful baby, but when she went home from her delivery, she started noticing things just don't feel like it used to before. Everybody reassured her that, it's normal in postpartum to feel like that and that it will get better by 6 weeks. By 6 weeks, though, Sarah was still complaining of leaking urine when she laughs or coughs or gives a sneeze. She started feeling a lot of pressure vaginally, even though her OBGYN told her that her tear from the delivery had healed completely. She just felt this fullness and heaviness. She did not know what to do and whether or not this will get better. By the time I saw Sarah, she was already 3 months postpartum, and she was so frustrated and upset because she still continued to leak, and now she was starting to feel like there was a ball or a bulge coming out from her vagina. She was so petrified to be intimate with her husband again because she was embarrassed. She didn't know what this was, and she was actually angry that nobody warned her about any of this. Does any of these sound familiar to you? Believe it or not, these things that Sarah is facing is very common. I see this so often among my postpartum patients. However, unlike Sarah, it does not have to be an unpleasant surprise for you. So let's talk about what should you expect in the postpartum journey. Number 1, bleeding and vaginal healing. Especially if you've had tears or an episiotomy, which is an artificial incision that your doctors might sometimes perform to get the baby out, bleeding for about 6 weeks after your delivery is very common. Most of the stitches that we use to repair these lacerations or an episiotomy will dissolve by itself, and that does take about 6 weeks to completely resolve. So a little bit of bleeding, a little bit of spotting, and vaginal discharge is normal in that period. What are some things you can do for relief? Sitz bath, ice packs, and also being patient and kind to yourself will be helpful. Number 2, bladder and bowel changes. Leaking pee when you're sneezing, coughing, laughing. This is what we call stress urinary incontinence. And the reason this happens is because of the weakening of your pelvic floor support structures, which can happen very commonly, especially for those women who have had vaginal birth, because of the trauma that the baby's delivery causes to your pelvic floor muscles and the nerves. Some women may also notice that they actually have trouble being able to have a bowel movement or emptying their bladder. A lot of this can happen because of nerve damages, either to your anal sphincter muscles or your bladder sphincter muscles, probably from birth-related trauma or nerve or muscle injury. Number 3, pelvic organ prolapse. So pelvic organ prolapse, the easiest way to understand it is think of it as a vaginal hernia. Because of the weakness of the pelvic floor support structures, your pelvic organs, which could be the uterus, the bladder, the rectum, the intestines, can push through the vaginal canal. Especially a woman who's recently postpartum, she could feel a lot of laxity, and then the pelvic organs feels like they're trying to come out because of that wide opening. Also remember, in the postpartum period, because of changes in the estrogen, especially for women who are breastfeeding and lactating, the connective tissue becomes very weak. So that can also exacerbate symptoms of pelvic organ prolapse. But don't panic. Pelvic organ prolapse and also incontinence, whether it be bladder or bowel, can improve with time, and also as you regain the strength of your pelvic floor muscles, as well as go back to the hormonal state pre-pregnancy over time. And also there are lots of treatment options that you can start even in the postpartum period, that is safe and effective to help improve these symptoms. If you're curious about what are some treatment options for pelvic organ prolapse as well as stress urinary incontinence, then definitely check out some of my other videos that I've made about these topics. I will put the link in the description below, so definitely check them out because you'll get a lot of very useful information. I have multiple videos where I talk about both conservative treatment options as well as surgical treatment options, depending on what your specific situation is and what are you expecting for your quality of life. And finally, I do want to emphasize the emotional recovery that every mother needs in the postpartum period. Remember, you've done something miraculous. You've done something amazing. You literally grew and gave birth to another human being. It does take a lot of strength, a lot of courage to be able to do this. I've been in practice for almost 15 years. I'm always amazed by the whole process of birth and how beautifully nature allows us to do this safely. So don't be too harsh on yourself. Give your body the time it needs to improve and recover, both physically and emotionally. And don't forget to ask for help, whether it's help from your loved ones, whether it's help from your healthcare providers, your physicians. And if you are somebody who's struggling with some of the things we talked about, ask to be referred to see a specialist like a urogynecologist like myself, so that we can talk to you about your specific condition and get you the help that you need to recover as fast as possible. In the meantime, once you've been cleared by your OBGYN or your midwife, you can start doing some exercises, some pelvic floor exercises. Consider working with a pelvic floor physical therapist, and also start learning and educating yourself about what's normal and what's not normal, and when to ask for help. In my next few videos, I'm going to be discussing exercises that is safe in pregnancy as well as in the postpartum period, so make sure you check that out as well. If you found this video helpful, then don't forget to share it with a friend. You can also sign up for my newsletter where I talk about the latest research and developments. And if you are somebody who is navigating the postpartum journey, then definitely hit the subscribe button, because this is the place for you. This is where you're going to learn all the information you need to make this transition the smoothest ever and enjoyable, so that you can spend your quality time with your loved ones, especially that little one. Hope to see you soon. Bye.